I'm Abdallah Fayyad. Tonight on Greater Boston, torrential rain and catastrophic flooding has hit Leominster hard. Will incoming Hurricane Lee add to the damage? GBH News meteorologist Dave Epstein joins me to talk about what to expect and how climate change plays into it all. Plus, student loan payments are back, and American borrowers owe a lot. How are other countries able to keep costs under control? And finally, a new COVID booster is coming out. When should you get it? Roads looked more like rivers after nearly 10 inches of rain fell on Leominster last night, prompting the state to declare a public emergency and the town to cancel school as flash floods washed out roads, inundated buildings, and forced hundreds to evacuate. It's one of the worst storms the area has seen in a while, but it's also part of a growing trend of more frequent and more severe rainstorms hitting the Northeast year after year. Weather and climate scientists say climate change is to blame. One of them, GBH News meteorologist Dave Epstein, joins me now. He's also been keeping an eye on Hurricane Lee as it makes its way up the East Coast. Dave, thanks so much for joining me today. So just to start off, can you give us a lay of the land of what exactly happened over the last few days? How are these towns managing with all the flooding?
Yeah, certainly a lot of rain. Good to be here with you. And what we had was a little boundary in the atmosphere, and that boundary basically got stuck over northern Worcester County into northern Middlesex County, and that provided the rainfall impetus to continue that rain for a long stretch of time. We call it, in some parlance, training, which means that the rain kind of goes almost like it's on train tracks. It keeps reappearing in the same area over and over and over again. Very unusual to have, of course, this much rain without a tropical system. Indeed, probably a once-in-200-year odds kind of event. Doesn't mean that these events will occur every 200 years. It just means the odds of these occurring is something like once every couple hundred years.
I mean, we're talking here about some, several inches of rain over the span of very few hours. Can you give us just a sense of how much rain they dealt with?
Yeah, well, as you mentioned, over 9 inches of rain in the Leominster area, close to 10. There's probably some places that did get 10. There's not rain gauges in every spot. And then many other areas, anywhere from 2 to as much as 6 inches of rain in a fairly widespread area across northern sections of Worcester County, Middlesex County, and even parts of Essex County. That's a huge volume of water. Our infrastructure isn't built to kind of handle that. People's basements is not built to handle that. And therefore, we end up with the flooding that we've seen over the past day.
And obviously, climate change over the past few years, has been said to be partly to blame for this rise in these kinds of tropical storms that we see. To what degree do you think climate change is playing into these storms, and should we expect more of this kind of rainfall in the years to come?
Yeah, I think it's important to keep in mind what climate change does to weather. Climate change is what's happening over long periods of time. Decades, even centuries, right? So we are warming up here across the planet. The Northeast is forecast to have more heavy rain events in the United States than any other area. So our heavy rain events are forecast to go up percentage-wise more than any other area. Would this heavy rain event last night have happened if climate change weren't happening? If all else equal, probably, but it might not have been as powerful. And so the frequency of these events and the intensity of the events when they happen is more likely being exacerbated by climate change. So certain things are going to happen anyway. It's weather. We have events like this. But as the climate warms, it makes these events bigger, more powerful, and more frequent. And that's how the climate impacts the weather we're observing.
So obviously you can't prepare for everything, and sometimes municipalities have to deal with torrential rain that they don't anticipate. This is a region that doesn't necessarily deal with the kind of rainfall we see in Florida or the kind of rainfall that we saw the other day. But how prepared is the state and the region for an increase in this kind of in these kinds of weather events?
Yeah, it's a great question. I think that a lot of municipalities are preparing for more water, right? If it's along the coastline, we know that sea levels are rising. If it's inland areas, we have to be prepared for these events, which will become more frequent. But a lot of our infrastructure was built long before climate change, in some cases, really got underway. And so some of this is just not ready for it and will never be ready until it's replaced or upgraded. And that's the challenge for all the cities and towns across not only Massachusetts, but frankly, the entire world. There's been incredible amounts of flooding in other parts of the world this summer. I mean, just in Libya over the past couple of days, an incredible flooding situation, which unfortunately took the lives of thousands of people.
And so what should residents expect from the state, from the federal government when it comes to aid and helping them out? What should residents expect in the coming days and weeks?
Yeah, so in terms of aid and financial aid and all of that from the federal government, I'd say, look to your local municipalities, check with wherever you check to find that sort of thing. As a meteorologist, I'm concerned with forecasting that stuff and the impact of it. That's going to have to be on the individual homeowner.
So residents are also preparing for this weekend or later this week, this upcoming storm from Hurricane Lee. What should people expect this weekend? And given the amount of flooding that happened, are the towns prepared for even more rainfall later this week?
Yeah, so right now Hurricane Lee looks like it's going to take a track just around Bermuda. It'll be to the left of Bermuda. It will not hit them. And then it's going to move off towards the north. You can see on this map here, this shows where tropical storm force winds, so winds over 39 miles an hour or higher, are forecast to occur. Notice that the heaviest odds or the highest odds are way out in the Atlantic, well east of New England. So in terms of wind, I'm not really concerned at all. The rain envelope from the system will probably nick eastern Massachusetts and certainly could end up hitting Maine. It depends on how close the storm comes to the United States as to whether or not we get into the swath of the heavy rain or whether or not we just have some showers. Either way, it's a fast-moving storm. I don't expect to see a ton of rain here unless the track dramatically changes over the next couple of days. So Saturday will be a breezy day. There'll probably be showers, especially from Boston east and northeast, but this will not, the way it looks now, turn into a major situation.
Are officials giving any guidance to residents as to how to prepare for that storm and or how to deal with what's going on now? What kind of guidance are residents getting from the state?
Yeah, so other than Lee, we actually have another rain event coming in for Wednesday when we're already under a flood watch for much of the state, including Greater Boston, including Leominster. So there will be some more showers developing during Wednesday, lasting into Thursday morning. That's not associated with Hurricane Lee. And then I would just say this to folks. Again, I don't expect Lee to be a problem around here. Just stay tuned to latest forecasts. If you have a coastal interest, perhaps a boat or a home or something like that, just listen to the forecast. If the track starts to trend off towards the left, in other words, we're going to get hit a little bit harder, that's the time to prepare. But at this point, I'd say there's really nothing residents should be doing because it just doesn't look like it's going to be a big deal around here from Lee as of now.
I think that's a good note to end on. Dave Epstein, thanks so much for joining us today.
You're welcome.
Next up, after a 3-year moratorium, student loan payments are back for many borrowers, and all payments are set to resume next month. Making those payments will be a challenge for a lot of borrowers who owe roughly $35,000 on average, much higher than nearly every other country on earth. Kirk Carapezza, GBH News Managing Editor for Higher Ed, joins me now to discuss. Kirk, thanks so much for joining me today.
Good to be here.
You had a great story about student loan payments and what people should expect, but also, how other countries manage this as well. But just to start us off, can you tell us about where borrowers stand now?
Yeah, right now, borrowers are anxious, right? The payments have been on pause, as you said, for the last 3 years, but they're coming due again in October, and they're really anxious. There's been a lot of talk about this in the media with President Biden's initial $400 billion proposal to just kind of forgive millions of loans. The Supreme Court struck that down in June. The administration has other plans to forgive loans, but those face legal challenges. So I think borrowers right now are anxious. The interest have started to accrue this month, and payments are due at will be due at the beginning of next month.
So people have a whopping, $35,000 on average in student loans. American education is very expensive. Higher education is very expensive here. But one thing that your story does is it points out that, things don't have to be this way.
Right. It could be a little more humane.
Exactly. And so, there are some countries where, there's no tuition at all. So,
right.
Some examples you use, for example, in Europe. Can you talk a little bit about some countries that, offer tuition-free college for their residents?
Yeah, in many countries, student loan systems and repayment plans differ significantly from the U.S. So it's not. There's many different models that we can point to. The economists I spoke to for the story pointed to Scandinavia first. You look at countries like Norway or Sweden, where education is widely seen as a public good, and tuition is completely free. Now, students do take out loans for their living expenses, or they point to Germany, where tuition at public universities is also free. I actually went there a few years ago. GBH sent me and my colleague Mallory Nopane to Cologne to look at the model there. It was around the time when Bernie Sanders was proposing free college during the campaign. And I remember interviewing students and, walking around, capturing man on the street sound. And we would just ask them, what do you think about student loans? And they were looking at me like I was an alien. They had no idea what I was talking about. And that was when I learned that the word in German for loans is Schuld. And the word for debt is Schuld, which is the same word for guilt or shame. And they had no idea what I was talking about. Now, in other countries where tuition is not free, these countries have embraced more quote unquote humane and sensitive approaches to student loan repayments.
Well, I wanted to ask you about that because one of the really striking examples that you use in your story is the United Kingdom,
right.
Which I was surprised their students actually have more debt than American
right,
students.
They have twice as much as us here in the U.S.
Which
right.
I was surprised by because college there, I believe, is cheaper, at least the semester's tuition.
Mm-hmm.
But what was interesting was how that repayment plan works. Can you talk a little bit about what they do in the UK?
Sure. I mean, first, start with the cost, right? The cost of public universities, it's, compared to the rest of Europe, it's relatively high. They charge, pretty high tuition and fees, but the amount is capped at about $12,000 a year, and students are entitled to loans that fully cover the cost, and 95% of them do take out loans. So that's why the loan amount there is so high. But there is this income-based repayment system that makes it easier for students to automatically deduct their payments through what's called employer withholding. And as you said, on average, students often borrow, twice as much as their American counterparts. But this income system provides kind of flexibility, especially during times like the COVID-19 pandemic, when job loss led to, automatic loan repayment pauses.
And so essentially they don't have to start paying back their loans until they can actually afford them.
Right, and if you're unemployed or don't have a job, you don't have to pay anything.
Right, and they don't have to worry about signing up for anything their employers
No,
take.
it's just automatic. It's
right.
automatic and seamless.
And so in reporting out this story, did you come across any examples outside the U.S., outside of the UK
yeah.
maybe, that where student debt, actually the system might be worse?
Yeah, right. I mean,
it's
easy to kind of look at our system. It's like, oh, everyone else has it figured out. That's not the case. I mean, there are inflexible repayment systems that can lead to some serious issues elsewhere. We looked at Colombia. When borrowers there couldn't repay their loans during the pandemic, the system just completely imploded. And we looked at Argentina. That country is a good example of how, access and free college don't always guarantee efficiency. The country rewrote its constitution back in 1949, and the plan was to make education a right for all and make tuition at public universities free. They dropped entrance exams to make it extremely accessible, but that access and free tuition did not translate to better education outcomes. Degrees there can take 5 to 9 years to complete. Argentina has one of the highest dropout rates in the world. We also looked at Nigeria. That country, in order to boost college going and completion rates, they actually recently introduced a completely new student loan scheme. And it's got nice, lengthy repayments. You have 20 years to repay. There's zero interest, which sounds pretty good, right? That would sound great if you were, had 20 years and no interest. But there's strict consequences for that. Defaulters have to pay fines. You could go to jail. You can't pass go. You can't collect $200.
Yeah.
So there are, I think together though these examples, what we were trying to look at was to collect these examples and these stories. There are lessons from abroad that can be valuable for the U.S. as we kind of grapple with our own student loan challenges.
Right. And I mean, one thing that you did for the story was talk to people who are
right.
paying back their loans. In talking to people who now have to worry about this after years of confusion as to whether or not student loans are going to be canceled, they're
right.
paused, when they're going to come back, they keep extending the deadline. How are people feeling about this? How are people feeling about the lift of the moratorium?
Yeah, in a word, I think people are anxious, right? We've had this 3-year pause where people could take that money and spend it on something else, maybe get a car, buy a home, things that student loans prevent young people from doing. And, the president's major $400 billion student loan forgiveness program was blocked by the U.S. Supreme Court. I think there's just a lot of questions about what's real, what's going to stand up to legal challenges. The administration is now facing lawsuits over some of its other policy changes that are designed to make it easier for borrowers to pay back their loans. There was one lawsuit recently filed against the Biden administration for its plan to cancel $39 million for some 800,000 borrowers. And it was filed by this group out of D.C. It's a libertarian think tank called the New Civil Liberties Alliance. And I spoke with an attorney there with the alliance, and he accuses the administration of bureaucratic overreach. It kind of reminds you of Obamacare, right? It's like, how much power does the administration really have? And this group says that, Congress should enact laws. Congress should control the nation's purse strings, and argues that one reason fewer Americans are actually going to college straight out of high school now is that there's this exorbitant amount of easy credit to students, right? And this attorney that I spoke with, he argues that we could learn from countries that don't give unconditional loans, right? Because when you give out unconditional loans to whoever wants a degree to pursue whatever they want, colleges know that students can afford it, and they end up jacking up their prices, and the government is just giving people bags of cash.
Right. And so, just to close this out, where do President Biden's current plans stand? One of the things that he came out with after the Supreme Court struck down his cancellation plan was an income-driven repayment plan. Where does that stand now? Yeah, it's called the SAVE program, and they're pushing it really hard. It launched over the summer.
Just quickly, here's how it works. Your monthly payments are based on your income and your family size. Since its launch last month, at the end of last month, the administration says that more than 4 million borrowers have signed up so far. That includes about 70,000 borrowers here in Massachusetts. Now, the administration says this program has the potential to provide relief to more than 20 million people who either have federally held loans or private loan debt that can be consolidated into a federal direct loan. I've spoken to some people who think that this is the next legal battle, that they're just waiting for a plaintiff, and that conservatives are going to try to strike this down too. People in my newsroom this morning were coming up to me and saying, is this something I should sign up for? Definitely check it out and see. But there is a reality that in this political environment, it could face another legal challenge.
Yeah. Well, Kirk Carapezza, thanks so much for joining me today. Great story. I really appreciate your time.
Thank you.
New COVID booster shots are right around the corner. The FDA just greenlit updated vaccines from Pfizer and Moderna, specifically made to target the XBB.1.5 subvariant. And the shots could make it to your pharmacy as early as the end of the week. So when should you get boosted? And what's the state of the virus here in Massachusetts as we head into the fall? Dr. Cassandra Pierre, the medical director of the public health programs at Boston Medical Center, joins me now. Dr. Pierre, thanks so much for joining me today.
Great to be here. Thanks.
So to start off, there's been a recent uptick in COVID cases, across the country. Where do things stand right now with COVID on the rise, and how's Massachusetts faring?
Yeah, we've absolutely seen a late summer rise in COVID infections, and Massachusetts has not been spared from that. We see that this increase continues on. Now, it is nowhere near what we saw during the time of Omicron, the winter before last, nor even this past winter. However, it is earlier than expected or anticipated, and partly related to the circulating variants that we have currently. So yes, it is an increase that we actually expect to continue to see increasing as school is restarting and people are moving indoors again with the start of fall.
So this new shot that was approved by the FDA, it was designed to combat the previously predominant subvariant, if I'm correct. So how effective is it for the new subvariants that have now become the predominant strain?
Yeah, it's a great question. It feels throughout this process as though we're trying to shoot for a moving target as the variants evolve. But the good news is that the pharmaceutical companies, Moderna and Pfizer, have independently evaluated the effect of this recently formulated vaccine against newer circulating variants at this point, and have found that for example, EG.5 or BA.2.86, which are circulating variants that we see at this point, that there is strong immunity produced, or at least a high level of antibodies that are produced after vaccination with the new vaccine. So that is reassuring.
That's great. And so, one thing that I wanted to ask you about is what clearly is vaccine fatigue, in the sense that, only 17% of those eligible for the last booster in the United States actually went ahead and got it. What are you expecting in this rollout for this booster? Are you expecting a lot of people to sign up, and what should we expect from the rollout of this new booster?
Yeah, it is. I have to be honest. I anticipate that we would continue to see some vaccine fatigue, maybe even aversion, or at least apathy. I think that we have seen part of our experience with these vaccines, in part, was formulated by an idea that at some point there would be an end to COVID. And although intellectually we know that COVID is part of our landscape, we may not have internalized that. So I think part of the vaccine fatigue that we see is also wrapped up in a desire to be done and over with COVID. But we can't wish it away. And that COVID or the vaccine fatigue that we see also unfortunately permeates to us as clinicians as well. When the other competing medical issues, I find it another issue that I have to address, but it is important for us to do so. And so my answer to your question is I certainly can anticipate that we will continue to see vaccine fatigue, but I think it is imperative for physicians, hospitals, public health institutions to try and as much as possible normalize this experience and compare it to something like the flu, for which we do have precedents of updating our vaccines, and continue to talk about this and talk about the reasons why we recommend vaccination.
And so I wanted to ask you, I mean, when the news came out yesterday that the FDA had approved a new booster, it was still unclear what the CDC was going to recommend for who should be prioritized and who should actually get the vaccine and who they were going to recommend it for. Everybody who's over 12 years old is eligible. I believe people between 6 and 11 are eligible under emergency authorization. But from your perspective, who should be going out to get this vaccine? Should it be everybody? Should it be the elderly? Should it be people with autoimmune diseases? Who should go out and get the vaccine when this is out?
Yeah, as you said, we don't have a sense at this point. Hopefully we'll get more information today about who the recommended populations will be. Certainly, I anticipate that there will be an emphasis on those who are at highest risk for severe complications of COVID-19. So, of course, those who are over the age of 65, those who are immunocompromised, those with multiple medical conditions that predispose them to severe COVID-19 would certainly be on the list because their risk is highest. However, because we have seen a shift in the landscape in terms of the variants that are currently circulating, and these vaccines provide much better targeting, better immunity to these circulating variants. It could be that the recommendation will make these vaccines eligible to anyone. And in that case, I would say that we may want to see this, because these vaccines are safe and effective, as a correlate to the flu vaccine that we usually get updated every year. So definitely heavy emphasis on those who are going to have more severe complications. But I also think it's helpful to think about this as a way to reduce infections, reduce getting sick, and enjoy time with our loved ones during the fall and winter holidays too.
So what advice might you have for people who may have gotten the vaccine before, maybe haven't yet even gotten the vaccine, but what advice do you have for people who are feeling a little hesitant about yet another shot this fall? What would you say to people who, are on the fence, if they're not necessarily part of a vulnerable population?
Yeah, that's a great question. I go back to what is the reason for getting vaccinated. Now, for those who don't fall into the risk categories of people who are at higher risk and may have already received their primary vaccine series, it certainly is true those individuals are probably less likely to develop severe disease, less likely to be hospitalized. However, as many of people in that population, that healthy population, can attest to, getting COVID-19 infections can be disruptive. They can cause you to feel crummy. And because we've seen this shift in the variants, getting the vaccine can, again, protect your winter holidays, keep your life running smoothly, keep you and your kids on track for that winter vacation that you might plan. So basically, going back to the reasons, the same reasons we might get a flu vaccine, which is to protect ourselves from severe disease, yes, but then also to reduce the risk of infection and allow us to live our lives in the fall and winter, and try and take back some of the time that we lost in the past 2 to 3 years as a consequence of this pandemic.
And so given the cases that were on the rise right now, should Americans be worried? Should people be worried about the direction of COVID now? I mean, obviously, you said this was something that, was expected. It's expected usually around this time of year for a rise in cases. But, given the way things are going, is there anything to worry about? Or do you feel confident that, COVID is still going to be under control come wintertime?
Yeah, I think the good news is that although we're seeing certainly an increase of cases, an increase of COVID-19 concentration in the wastewater, we haven't in many cases, I mean, we've seen a slow rise in hospitalizations, but it certainly is nowhere near the catastrophic increases we saw at the beginning of Omicron or even the Delta variant debuts. We have experienced milder cases, not because COVID itself has become milder, but because we have gained better societal immunity based on our vaccination and our collective history of prior infections. So will this be more manageable? We anticipate that it will be so. However, it is also true that there will be preventable deaths that will occur, preventable hospitalizations that will occur. And so while we expect that this will not be anywhere near the level of disruptive that it has been in the last few years, it will hopefully remain manageable. It is also important as individuals to understand what our risk is and what our goals are this fall and winter, and avail ourselves of things that can prevent or treat infection to keep ourselves healthy.
So we just got word in the middle of this taping for viewers, just for clarification, the CDC is now recommending the new COVID booster for all Americans 6 months and older. But Dr. Pierre, I just have one last question for you. You know, as an expert in public health, you know, looking out towards the fall, is there anything outside of COVID that you're looking out for in the coming months as kids are back in school and you know, winter comes up? Is there what are you looking out for?
Well, we certainly had a prolonged RSV, respiratory syncytial virus infection period in the fall and winter, even part of the summer last year. And so that is certainly something that we're keeping an eye on. And luckily, we have had some updated or some new vaccines for RSV, which will be helpful for higher risk populations. And of course, flu, as always, it remains on our horizon. And so I think it's helpful to think of COVID as part of this kind of package or trio of major respiratory viruses that we encounter in the fall and the winter. And again, trying to do everything in our power to keep ourselves out of the hospital, surely, but also keep ourselves safe, healthy, and able to enjoy time with loved ones. But yes, there are other viruses outside of COVID that will be part of the landscape this fall and the winter. And, it's always a little bit unpredictable. So we'll have to see what we see for the trajectory for those other viruses as well.
Well, Dr. Cassandra Pierre, I really appreciate you coming on to explain all this to us. Thank you so much for your time.
Thank you. Take care.
That's it for tonight. We'll be back tomorrow. I'm Abdallah Fayyad. Thanks for watching. Good night.